Do not take baking soda unless you watch this video. You've probably used baking soda your whole life, maybe for heartburn, maybe in your toothpaste, maybe even to freshen your fridge. But here's what no one told you. That innocent white powder could silently be sabotaging your kidneys, your digestion, your minerals, even your bones. And if you're over 60, the risk is even higher. Because as your organs slow down with age, what used to help you may now hurt you. And worse? No one's warning seniors about this. So before you mix that next spoonful into water, hear this. Baking soda can help you avoid dialysis, or push you closer to it. It can heal your gut, or destroy your digestion. And one tiny mistake seniors make with it every day could make your body stop absorbing calcium, magnesium, and even vitamin B12. Let's break the silence on baking soda. You've heard baking soda can soothe acid reflux. And yes, it can temporarily. But take it the wrong way or too often, and here's what can happen. According to the National Kidney Foundation, kidneys already lose function naturally with age. But when you flood your body with alkaline compounds like baking soda, you're putting even more stress on those filters. Too much sodium bicarbonate, and now your kidneys can't balance your blood's pH. Your stomach needs strong acid, pH 1 to 3, to digest protein and absorb nutrients. But baking soda neutralizes that acid. Result? B12 deficiency, protein malabsorption, constipation, gut infections. Yes, your stomach acid is your first line of defense against bacteria. When your body becomes too alkaline from chronic use, you start losing potassium and magnesium. That means cramps, weak legs, irregular heartbeat. Fatigue. Mayo Clinic warns that poor mineral absorption over time can worsen osteoporosis. So if you're neutralizing stomach acid too often with baking soda, you may be draining the very nutrients your bones depend on. Most seniors never realize that their natural remedy is slowly weakening them. Here's the part no one told you. Most seniors who take baking soda for acid reflux actually have too little stomach acid. Yes, low acid, not high. According to Harvard Health, many older adults develop a condition called hypochlorhydria, low stomach acid. But it feels like heartburn. Why? Because food sits in the stomach too long and ferments, pushing acid upward. Taking baking soda in this case makes it worse. What actually helps? Apple cider vinegar, 1 tablespoon diluted in water, or betaine HCl, a natural acid booster. These support your digestion, not suppress it. So if your acid reflux is from low acid, baking soda is the worst thing you can take. Let's go deeper with 3 ways to use baking soda safely, and 3 situations where it could secretly damage your health. Safe use 1. Kidney protection, only if advised. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, reports that in certain chronic kidney disease, CKD cases, baking soda may delay dialysis. Why? Because damaged kidneys often fail to regulate acid levels. Taking controlled doses of sodium bicarbonate can reduce metabolic acidosis, slowing kidney decline. But here's the catch. Only take it if a nephrologist advises you to. Dosage must be exact. Too much and your blood pressure can skyrocket due to sodium overload. Open loop. Later in this video, I'll show you how baking soda affects itching and kidney disease. That symptom alone could signal your kidneys are in distress. Safe use 2. Mouth health. Surprising but true. Baking soda can reduce acid in the mouth, which helps prevent tooth decay and gum disease. That's why many toothpastes contain it. According to a 2021 review in the Journal of Clinical Dentistry, brushing with baking soda-based toothpaste improves plaque removal and reduces oral bacteria. So if you want to make your own, mix 1 teaspoon baking soda, a few drops of coconut oil, optional, drop of peppermint oil. Use this paste 2-3 times a week, not daily, to avoid enamel erosion. Safe use 3. Insect bites, only some. Some insect bites, like fire ants or bee stings, inject acidic venom. In those cases, applying a baking soda paste neutralizes the acid and reduces pain. But here's where most people go wrong. Wasp stings have alkaline venom. Baking soda makes it worse. Spider bites? Better to use activated charcoal or bentonite clay. Snake bites? Call 911. But know that milk thistle may reduce liver damage from venom. Never assume baking soda works on every bite. It can backfire, literally. Let's bust a myth. Heartburn means too much acid. Wrong. According to Stanford Medicine and Mayo Clinic, over 60% of seniors with reflux symptoms actually have low stomach acid. Yet doctors often hand out acid blockers or seniors turn to baking soda. Result? Gut infections, bloating, malnutrition. Increased risk of dementia from B12 deficiency. New research shows that restoring stomach acid, not blocking it, can eliminate symptoms and restore digestion. This changes everything. So next time you feel reflux, try this test. Drink 1 tablespoon of apple cider vinegar in water. If the burning improves, you need more acid, not less. Major daily habit or mistake to avoid. Mistake: taking baking soda with lemon juice or vinegar. It sounds smart, right? Mix the two and drink it down? Wrong. That combo causes an instant chemical reaction, carbon dioxide. You'll feel bloated, gassy, and nauseous. Worse, this explosive gas pressure can worsen hiatal hernias, increase acid rebound, and strain your esophagus. Mayo Clinic confirms. Avoid combining acidic foods with alkaline buffers unless you're doing a chemical science experiment, not something for your stomach. Other common mistakes seniors make with baking soda. 1. Using it daily for reflux. Even small daily doses weaken stomach acid over time, leading to GERD. Nutrient loss. Infection risk. Only use it occasionally for emergency relief, not as a habit. 2. Taking it with medications. Sodium bicarbonate interferes with blood pressure meds, diabetes drugs, aspirin, antibiotics. Always leave a 2-hour gap minimum. Better yet, ask your doctor first. 3. Ignoring its sodium load. Teaspoon of baking soda contains over 200 milliliters of sodium. That's more than half your daily limit as a senior. This can silently raise blood pressure and increase your risk of stroke or heart disease. The right way to use baking soda, if you must. If you still want to use baking soda occasionally, here's how to do it safely. 1. Dose it carefully. Max dose: 1/2 teaspoon in 4-8 oz of water, never more than once every 24 hours without medical guidance. 2. Track your sodium intake. If you're eating processed food, canned soup, or salty snacks, skip baking soda that day. 3. Avoid long-term use. Never go beyond 7 to 10 days continuously. 4. Watch for symptoms. If you feel nausea, cramps, tingling, confusion, stop use immediately. You may have electrolyte imbalance. These are not the same. Baking soda, sodium bicarbonate. Baking powder equals sodium bicarbonate plus acidic agent plus cornstarch. Baking powder should never be consumed as a remedy. Mistaking one for the other has led to ER visits in seniors. How to use baking soda for kidney itch. Chronic kidney disease often causes itching due to high acid buildup. Applying baking soda water externally can relieve that itching. It's a symptom signal, not just a skin issue. But again, don't take it internally unless guided by a nephrologist. Your stomach acid isn't your enemy, it's your protector. Yes, baking soda has its place. But in the wrong hands or with the wrong body chemistry, it's like putting out a fire by flooding the whole house. If you're over 60, your digestion, kidneys, and bones need precision, not guesswork. The very thing that helps you breathe easier today might weaken you tomorrow. Now you know better. Use baking soda like a medicine, not like a multivitamin.